our three wonderful speakers who I'm going to introduce all three of them, and then we'll have them get started. There'll be time at the end for questions and things like that. And again, booths will be open after the speakers, so if you didn't get a chance, you can go ahead and complete the ones that you didn't get to do.
Thanks.
I should introduce myself as well. I'm Emily Hemedinger. I am the clinical director of our OCD program, and we am just so excited that this is happening. So let me introduce our speakers. So first up, we'll have Dr. Rachel Davis. She's the medical director of the OCD program and also vice chair for clinical affairs and strategy in the Department of Psychiatry. She collaborates with neurosurgery to run the deep brain stimulation for OCD program. Dr. Davis has lived with OCD since childhood and is passionate about reducing mental health stigma. Yes, that is a really good one. We've had quite the road to get this event started, so I'll let Rachel maybe talk more about that. Our next speaker, Dr. Moksha Patel, is a physician and assistant professor of hospital medicine here at CU Anschutz. He has also been battling with OCD, depression, and anxiety since early childhood. It was a battle he felt he was often losing, until a rare but effective brain surgery changed his life. Today, he will share some of his story in living with OCD and the many lessons it has taught him about brain health and life in general. And then finally, we have Reverend Katie O'Dunn. She's the founder of Faith and Mental Health Integrative Services, an organization helping individuals with OCD and related disorders live into their faith traditions as they navigate evidence-based treatment. Prior to this, she spent 7 years serving as the Academy chaplain and the Pauline and R.L. Brand Jr. 35 Chair of Religious Studies at Woodward Academy in Atlanta, Georgia. While serving in this role, she also served as a consultant on interfaith programming for schools around the country. Katie is proud to be an International OCD Foundation lead advocate, an ordained minister in the United Church of Christ, and an endurance athlete tackling 50 ultra marathons for OCD. She is currently pursuing her doctorate at Vanderbilt to continue with her focus on faith and mental health. She has graduated from Candler School of Theology at Emory with her Master of Divinity and Certificate of Religion and Health in May 2015. So, to start us all off, let's welcome Rachel Davis.
All right, before I start, I want to do a toast. So, who all has a urinal? Can someone get a picture? A toast to coming and doing weird things, challenging stigma, and weird but important things. So, cheers. All right. So, I have written about being a doctor with OCD, and the number of pre-med students and medical students and residents and practicing physicians who have reached out after they've read what I have written has given me the courage to keep talking about being a doctor with OCD. However, this is only the second time that I've given a talk about it, and I'm honored to have the opportunity to model vulnerability and share my story. I'm also very nervous because even though I do a lot of public speaking in my job, I'm not a big fan of it, and I'm usually not talking about myself. I'm also usually not dressed like a fairy. In fact, I never dress like a fairy. So, anyway, probably the other most important thing to know about me is that I love animals and I love to travel, and this is one of my favorite pictures on Kangaroo Island in Australia. So, I grew up in a religious family in rural southeastern Colorado, a town of about 800 people. We grew up without a TV. We had candy days. My brother's here, he can attest to all this. We had candy days, so we were allowed to have candy on Wednesdays and Saturdays. We got $2 allowance each week, and 10% of that had to go to tithes, 20% of that went to savings, and the other $1.40 usually went to candy. We had 84 people in my high school and 20 people in my graduating class. And this is where I grew up. this better? Yeah. Okay. Bringing the slides back to fancy. They were for a minute and then they stopped. Well, I'll keep talking. The next picture is me as a child holding a chicken. So I came by my love of animals. Honestly, we grew up with a zoo, so we had cats, dog, hamsters, mice, chicken named Colonel, who you'll see in the picture hopefully, a rabbit, occasionally a snake, a parrot, two cockatiels, crawfish, lizards, and whatever animal my mom happened to have rescued. I was an anxious child when I was an infant. I didn't like to be held or touched, especially if I was upset. I had night terrors, I cried a lot, and I was always afraid my parents were going to die. But I also enjoyed things, so we would have blizzards out on the plains, and would love building forts in the 6-foot snowdrifts, would go explore the field next to our house, go to the library. There's not a lot to do in a town of 800, but we found things to do. I didn't necessarily fit in very well. I was called weird, and sometimes I was bullied. I was a creative child. I wrote a poem about having squid for lunch, won a poetry contest. I would build cricket habitats, and tried to teach my mouse to use the dollhouse toilet. It did poop in the toilet. I think it was just scared to death. But that creativity also fostered lots and lots of worries. So we'd drive by a car accident, and I'd perseverate on what must have happened to the people in the cars. Weekly Sunday school, Bible studies, Southern Baptist revivals fueled fears of going to hell, and I would recite a prayer in an attempt to prevent bad things from happening. It was, "Dear God, please forgive me. I love you very, very much. In Jesus' name I pray. Amen." Around the age of 11 or 12, I became hyper-focused on time passing, and was very sad that I was getting older. I would spend a lot of time under my bed, curled up in a ball. And for as long as I can remember, I have lived with a constant sense of dread and a fear that something was and is terribly wrong. So for reasons I still don't entirely understand, I have always wanted to be a doctor. And that is a gift that has given me purpose and a sense of direction. When I was 3 years old, I wanted to be a brain surgeon. Well, actually, I wanted to be a bird. My preschool teacher told me that wasn't possible, and so then I think I decided I'm a brain surgeon. I would read all the medical articles in my mom's magazines, and whenever we'd get Christmas money, I would buy medical books. And around the age of 11 or 12, the same time I started becoming worried about time passing, I would also sneak upstairs and grab my parents' American Medical Association family medical guide, and I would memorize symptom flowcharts late into the night. I think this served me well by the time I got to medical school, but it was also a sign of health anxiety. So by the time I was 13, I decided I have polycythemia vera, which I now know is a disorder usually only older men get, usually, and also Hodgkin's lymphoma. At one point, I decided I was going to accidentally swallow my tongue, and so I stayed up late into the morning sitting on my bathroom counter, trying to make sure I wouldn't accidentally, on purpose, accidentally swallow my tongue. So I was fascinated by the human body, and I was also terrified by it. I was terrified of my own body. You know, we talk a lot about accommodation in OCD and how it's not useful, right? It can be tempting to try to help the people you love feel better by helping them with their OCD. My parents, for better or worse, did not accommodate at all. And while that was certainly hard in some ways, I think it has served me well. They sent us to music camp. It was an 8-week music camp, and I, was homesick even if I went to a sleepover. And so I would spend the first 4 weeks crying because I was homesick, and I would spend the second 4 weeks crying because I was going to have to go home and leave the friends that I made. This is a poem that no, it's not a poem. It's something I wrote when I was at camp, trying not to cry in front of people. I said, don't cry, it won't do you any good. You won't get anything by crying. You won't get anywhere either. You've got to do something so you don't want to cry. Control yourself, think, and do what you need to do. There's always some way to do what will help. Give yourself some relief. And the music camp was Interlochen, and so they had a uniform, which was blue knickers, red sweaters, and knee socks, based on what age group you were. So when I was 15, I rebelled, and I begged my parents to please let me to go to a pre-medical sciences camp at Johns Hopkins instead of going to music camp, and they gave in. It definitely pushed my capabilities. I was still homesick. I cried a lot. I was very anxious. But part of the thing is, when you grow up anxious, you don't really know any different. So you just keep moving forward. My roommate and I decided we wanted to watch surgery, and we were on the undergraduate campus, but we walked down the street to Baltimore Memorial, and we told someone we wanted to watch surgery, and they connected us with a surgeon who took us into open heart surgery and let us take a picture. So pretty sure that wouldn't happen now, but you know. When I was 15, I took an EMT class and a nurse aid class, and I ended up working in the nursing home and also on our local ambulance, and I was exposed to a lot of blood and a lot of death, and I was with a lot of people as they died, whether that be from car accidents or heart attacks or dementia. And I would say this is how I actually began to learn to live. Helping others during the worst times in their lives gave meaning to my life. And now I understand that this meaning was also helping me move beyond the terrible noise in my head. It was traumatic, and it's not something I would probably recommend to most adolescents. But I think for me, it was necessary, and it's what helped me actually move forward in life. It was less painful to deal with real trauma than to be completely helpless against the fears that my brain made up. So this is actually a picture of our local hospital. It's a one-bed emergency room. So when we have car accidents with multiple people, we have patients in this emergency room, literally a room, people in x-ray, people in physical therapy, people in the hallways. You can imagine it was quite chaotic. College, I graduated in 3 years with a 4.0. I would not recommend that. But I was determined to be done. It wasn't because I wanted to do something important or that most people didn't do. I just wanted to be done. I wanted to be done so I could go home, and I thought I wanted to be the town doctor at that point. When I first got to college, I thought I wasn't going to survive because I couldn't figure out how to study without crying, but I realized if I went to Barnes & Noble, there was enough distraction around that I could actually pay attention to study and not get caught in my head. And so I basically lived at Barnes & Noble or sometimes Denny's. I also worked a lot during college. During my first year of medical school, I was fairly tortured. I barely slept. I learned it was easier to get up in the morning if I drank a lot of coffee before going to bed at 2 a.m. I snuck away between each lecture to be by myself for a few minutes. I recited the Lord's Prayer over and over and over again, trying to calm my mind. My preceptor asked if I was all right because I was so thin, too thin. And I was too thin partly because I didn't make time to eat, and partly because I was so worried about money that I didn't buy myself enough food. I was ashamed that my preceptor had noticed. Mental illness was not something in my family that we talked about. It wasn't allowed. And at that time, I also couldn't let go of the images I had seen during my time as an EMT. 9/11 happened during anatomy, and I couldn't stop thinking about death. So a classmate had written in our school humanities journal about his struggle with depression, and I got the nerve to reach out to him. He was kind, and this gave me courage to ask for help, not right away. I told my parents that I thought I might be depressed. They told me I probably wasn't. I think that's because for them also mental illness wasn't a thing, and they couldn't bear to think that I might be depressed because they wouldn't know what to do with that. At that point, I only felt comfortable seeing a Christian therapist. So this therapist asked me to sit and listen to God. So I spent hour after hour sitting in silence, wondering what was wrong with me, because God certainly wasn't speaking to me, at least not audibly. This only made things worse, so I eventually surrendered and saw a secular psychiatrist. She prescribed medication, we met weekly for therapy, and this was the beginning of a new life. I began to have room to breathe, and the strength and space to interact with other people. This was also when I was diagnosed with OCD. So fortunately, despite OCD and thanks to meds and therapies, I actually enjoyed my clinical rotations. I provided good care. My patients, residents, and attendings liked me, and it was nice to be liked. When I talked to some of my former classmates, they described me during that first year of medical school as a mousy, not very nice person who kind of kept to herself. And since I didn't, once I started meds and therapy, since I didn't have to direct all my energy towards survival, I had more room for the nuances of human interaction, and I felt a little more human. Now on the OB-GYN service, I couldn't bring myself to participate in certain procedures, not because I felt like I needed to make a political statement, or I felt judgmental, but I was still afraid of going to hell, a remnant left over from scrupulosity from growing up as a child with OCD in a very conservative Southern Baptist family. So I figured out how to do well in medical school, and I started to have friends, but I still had severe OCD. Back then, I felt a lot of shame. Now I have compassion for myself. I still have OCD. I'm a doctor with OCD. A few years ago, one of my supervisors remarked, "You come in here every day looking like you've done something wrong." And I was embarrassed that he had noticed, but he's right. My brain is still almost always telling me that I've done something wrong or will do something terribly wrong. I think I skipped a page of notes. Yes. So I've learned most of the time to live and practice despite what my brain is telling me, but I'm not always successful at hiding it. One of my patients with OCD said something I found particularly poignant. And I'm going to read this as her quote. She said, "An OCD sufferer is fighting a war with a brain that randomly gets hijacked by horrifying images and thoughts. And sometimes this secret war makes its way out of our tortured brains and furrows our brows, making us look," not appropriate word because their kids are here, but basically she said she gets tired of people telling her she has resting. Not a nice person, okay. And I'm aware that I still sometimes come off as distant and standoffish, and this is most often because I'm trying not to let my OCD show and doing my best to make sure bad things don't happen. So my baseline, like I mentioned, is probably every day is feeling like people are upset with me, feeling like I've done something to hurt someone, being offensive, that I'm creepy or inappropriate. And most of the time I can push past this and act normal, but cognitive dissonance is hard. So we don't like it when our brain is telling us something's different than the environment is telling us, right? So I found that I'm actually drawn to more acute situations. I like to manage crises. I like to help people who are dealing with really hard things, because putting out real fires is better than trying to put out imaginary fires that you have absolutely no control over. So I'm good at managing crises and bringing calm to chaos, and I've learned to take my lifelong struggle and utilize certain aspects of it for good. But this doesn't mean things are perfect. I often don't feel calm. My brain is rarely capable of feeling capable, but I just move forward anyway. I take medication, I go to therapy, I make conscious choices every day to resist my OCD so that I can live my life and I can provide good care to my patients. I try to set aside on most days the constant feeling that something is dreadfully wrong. But sometimes I still listen to my fears, like when I find myself on Google looking for my patient's obituary. They really just forgot to come to their appointment. My desire to become a doctor is what helped me overcome my extreme anxiety, and my desire to be the best possible doctor helps me navigate each day. I'm very grateful that I seem to have been born with a purpose. And I've come to realize that it's not only in spite of my OCD, but also because of it. I was driven to do hard things at a young age. Partly because I needed a distraction from the chaos of my brain, and I needed a sense of meaning outside of the chaos. My OCD, and some people will disagree with it. Some people are insistent on saying nothing positive can come from OCD, but I think when you grow up with OCD from as long as you can remember, it's hard to separate that. So for me, my OCD attributes to me being conscientious, empathetic, detail-oriented, very an advocate for justice, and these are things that when out of control can cause problems, but when reined in, contribute to being a good doctor. So now I'm going to talk about something, final thing, that may seem a little bit unrelated, but you'll, I think, understand at the end why it's related. So when I was in medical school, they talked to us about living liver donation, and I thought it was just amazing that a living person could donate part of their liver to someone, and their liver would just grow back. And at the time I thought, well, that's amazing, I want to do that. And I reached out to the medical director of transplant at that time, and he amazingly took me seriously and met with me. Non-directed anonymous donation was not a thing at that time. They still questioned people's sanity. Why would someone want to give away part of their liver to someone they don't even know, and thought there must be something psychologically wrong with them. But he met with me and he said, well, we need to do a psychological exam or psychological evaluation. At that time, that freaked me out because this was still before I had acknowledged that I had mental illness or gotten treatment in any way. As a medical student, I wouldn't have been able to recover from donating part of my liver. But about a year and a half ago, I came across an article on the UC Health website about a woman. Actually, she had donated both part of her liver and a kidney, non-directed or anonymously, and there was a link to fill out the form to be evaluated at UC Health. And without really even thinking, I filled it out. And I thought, they are not going to want to touch me with a 10-foot pole. They're going to see my medication list and my list of diagnoses, and they're going to be like, absolutely not. So I followed it up with an email to the living donor coordinator, and I just said, hey, I know you're going to see my meds. It's going to worry you, but I actually function very well. I'm a physician. I just, FYI. Well, they called me the next day, and she said, I ran this by our medical director. He said we can proceed. And the team was amazing. They were non-judgmental. They were realistic. They wanted to make sure that I recognized the impact this could have on me, that I was prepared to deal with worsening of my mental health if it would happen. But ultimately, I was approved to donate 55% of my liver to someone I didn't know at the time, but have since had the privilege of meeting. And for me, this was meaningful for many reasons, but partly because I used to be terrified of my body and ashamed of my brain. And to be able to donate part of my liver, I am proud that I was healthy enough, both mentally and physically, to literally help save another life. And that is just a marker of how far I've come with my OCD. And while everyday life is not easy, I also have a beautiful life, a life that I enjoy, and I've learned it's possible to navigate life and enjoying the beautiful things while also at the same time feeling the painful things. So, if anybody's interested in learning more about living liver donation, I do have some cards over there on the Rogers table with a QR code to a website that I put together, and then also a little plug here. We're doing a podcast called Transplant Talks about living donation, and there's a QR code for the talk there. We've only aired one episode so far, but we should have more coming. So that is my story. Thank you for listening. Probably get rid of my liver. Unless you want them up for your talk. Okay, here we go.
Hello, everyone. I wanted to start off first and foremost by thanking all of you for being here. Whether you're a patient who deals with OCD, a provider who takes care of these patients, or just a community member here to learn more about OCD, that compassion and dedication is what moves society and healthcare forward. So thank you. Second, thank you for letting me share my story today. It's a story of my personal battle with OCD, but it's a story I feel that many of you, even without severe OCD, can relate to. And in sharing the story, there's a few messages I hope to convey. First, you're not alone. We're all in this together. All of us in this room, and thousands of others have your back. Second, even when you lose all hope in recovering from OCD or other illnesses, there is always hope on the horizon, and I'll illustrate that with my story. And finally, it's possible to live a life full of meaning, even with significant OCD symptoms. So with that, my name's Moksha Patel. I'm 33 years old. I am an assistant professor of hospital medicine here, just a couple buildings down in Anschutz. But I'm here to talk about my journey as an OCD warrior. For me, OCD has always felt as a brain disorder in which I got repetitive, intrusive, and unwanted thoughts. They would hijack my brain. They would cause immense distress. And in an effort to reduce this distress, I would perform rituals. And while the rituals may temporarily alleviate some of those distress, long term, it really just reinforced the cycle of fear. I've had symptoms as early back as I can remember. 4 or 5 years of age, I would ask for reassurance and confessions. My family knew what I was doing was abnormal. They kind of teased me for it, but no one knew what it was called. They didn't know about OCD at the time. In middle school and high school, my symptoms became more physical. It really started to stem more to contamination issues. I would wash my hands every 10 to 15 minutes to the point where the skin was breaking and I would bleed. I was so afraid of germs that I would not use any public restroom, only use my restroom in the entire world. And after using the restroom, I would shower for an hour each and every time. Well, as you can imagine, that's a distressful process. And so I would avoid eating and drinking to try to avoid having to use the restroom. I've also used just about every commercial cleaner and some of the hospital cleaners on my skin, in my face, in my mouth, name ways you're not intended to use them. But OCD sinks deep. That's just the tip of the iceberg. It affected where I went to college, how I drove, how I studied, my relationships. You name it, it affected it. I was always stuck in the past or worrying about the future, never able to focus on the present. I wrote this quote in my diary in 2007, around the time I was diagnosed, and I'd like to read it here to kind of show the despair I was feeling. There are few fates worse than that of being imprisoned within the untouchable and thus impenetrable walls of the mind's penitentiary of uncertainty, doubt, and irrationality. Day after day, you sit in this mental cell, abiding by the strict rituals and rules set by the subconscious part of your mind. Failure to comply, obey the commands or compulsions of the correctional officers, results in heavy punishment, such as solitary confinement and the galling anxiety that comes with it. That these sufferings are insignificant compared with the prison's ghastly effect on our morale, with its cruel tendency to drain us of our innermost motivation, determination, and perseverance. Before long, you become hollow, unlively, and weak. Even the desire to escape is too much to bear. Gradually, the desire to enjoy, to play, to read, to learn, in short, the desire to live itself begins to seep from you. This becomes your life, your prison, your home. Now, around the time I wrote that quote, I was officially diagnosed. Since then, I've seen over 12 professionals in 3 cities. I've tried numerous forms of therapy, including the gold standard exposure response prevention therapy, psychodynamic therapy, DBT. I've been on over 14 medications for psychiatric indications in my life. I've also tried alternative treatments, including yoga retreats, mindfulness meditation, exercise, breathing exercises, all this while training to be a physician. And while with the help of my care team, I was able to keep the OCD at bay, I literally felt like I was drowning in my thoughts. To the point where I wrote this second quote a couple years ago. Imagine your mind, the basis of your reality, has been consumed for decades by a thrashing sea storm, with waves of unwanted thoughts, followed by the thunder and lightning of dreadful anxiety. Beneath that, there lies an unyielding need for certainty in a world full of doubt. Imagine drowning in that existence for years and failing every attempt to ascend. Then, when you have finally given up hope, the miracle of a rare but effective brain surgery changes your reality. The obsessive waves are subdued, and the burden of thunderous anxiety diminished. You can finally learn to stop seeing the world in black and white and appreciate the beautiful colors instead. That is the blessing that deep brain stimulation surgery has been for me. Since receiving the surgery in September of 2021, My life has changed. I told Dr. Davis at our most recent appointment, I feel like we have two different brains. There's the pre-op brain and the post-op brain. I finally feel some semblance of control over my brain. I will say that DBS has not been a cure. It is a treatment, a very effective one for me. I still struggle with depression, mental illness on a daily basis. However, before, where I felt like I had no power over these diseases, I now feel some semblance of control. The second thing I'd like to point out about DBS is that while it gave me the tools to work on the disease, I still have to put in the work with weekly exposure response prevention therapy. Habits that have been formed for 20 to 30 years don't break easily, even with probes in your brain. And so putting in that work has been really crucial and really rewarding for me. The third thing is, while DBS has had some really amazing effects for me, it has come with some unexpected challenges. I would say that pre-surgery, my brain was consumed on an estimate average by 70% of sessions. Now it feels a lot closer to 20%. Well, that 50% of bandwidth and RAM in my head feels really, really empty. And that emptiness, while that silence and quiet, can be shocking at times. And I'm learn to live and deal with that now. But ultimately, what DBS has allowed me to do is live a life full of value instead of a life full of fear. Now, I can guarantee that everyone in this room, even those of us who don't have severe OCD, know that feeling of fear. That feeling that creeps up on you, makes you doubt everything, makes you second guess yourself. But here's the thing about fear. Fear is a one-eyed monster. It only looks at what you can lose. It never looks at what you can gain from the challenges and opportunities presented to you. So my first ask to you is, the next time you feel that irrational fear creep up on you, look fear in the one eye and say, not today. Today I'm going to live a life based off of my values and my decisions. And finally, I'd like to end this talk by just some of the lessons that I've learned with the ongoing war with OCD. The first lesson is, you really are not alone. At times I felt alone. I'm sure at times all of us feel alone. But humanity, your providers, your family, your friends, your support systems are all there to support you. OCD wants you to feel alone. That's how it gets you in the corner and gets you to do what it wants. Remember that we're all here to have your back. Second, OCD is like any other disease. There are psychosocial factors, but there are also biological, electrical, and chemical factors. I had providers and family members tell me I wasn't getting better because I didn't want to. And yet, you put 2 probes in my brain, change the electric circuitry, and all of a sudden I want to get better. What it comes down to is, this is a complicated disease, and having experienced providers who really understand it and can address all of those components is essential. Third, while recovery may seem impossible at this time, it isn't. I had truly given up hope. I really, even when DBS was heard of, it kind of seemed like this far-fetched idea. But my care team and my support system, my family, my sister especially, never let me quit. And by not letting me quit, I was able to wait until hope finally found me. So I'd like to end with some steps I recommend for people still dealing and struggling with OCD. The first step is accept it. This is a disease like any others. Like the hypertension and diabetes I treat on a daily basis as an intern. So let's go beat it. Second, get an experienced provider, someone who knows the evidence. Our department here is phenomenal and will treat you with compassion, empathy, and knowledge. Third, you're going to have to put some work in. We've had a great exposure to exposure today and understand what it's like. For me, it involves, I still haven't done the toilet station yet, but it involves going into public restrooms, touching things, and preventing my response of wanting to wash my hands, wanting to shower, etc. Fourth, OCD is a marathon, not a sprint. My favorite quote ever is by Mary Rodmacher. Courage doesn't always roar. Sometimes courage is the tiny voice that says, I'll try again tomorrow. I feel that epitomizes a battle with a chronic illness, especially with OCD. Do your best every single day, and no matter the results, do your best the next day. And fifth, when you get a chance, try to take a vacation from your head. Your head can be a beautiful place, but it can also be a scary place at times. Read a book that you enjoy, watch a TV show that you enjoy, laugh. Those are all ways to get outside of your head. People often ask me, how on earth did you complete residency training, working 80 hours a week and 28-hour shifts while not using the restroom and showering so much, and etc. And while it was very difficult, I actually think being a physician was protective for me. It allowed me structure and allowed me time to get outside of my head to relate to the patients I was treating and understand their story, their sorrows, their joys. And that really was protective. Since getting the surgery, I've gone from completing cleaning rituals for 5 to 8 hours a day to having that space that I talked about a little earlier. And I now can do things that I value. I'm socializing more. I'm speaking and advocating for OCD. I developed an app which is sponsoring this event. Ask me about it afterwards. I am doing things that I value. Pre-surgery, I often felt that I had to master everything. Everything had to be perfect. Any doubt, any uncertainty would drive me crazy. And now I've realized that really my goal is to grow in some way each and every day. So that is my journey and ask of you. Today I have grown by making myself vulnerable and sharing my story. I hope you will join me on this journey and continue to grow in some way each and every day. Thank you.
Hi everyone, I am so incredibly honored to be here. I'm Katie O'Dunn. I always like to let folks know that I always put the reverence so folks know that I'm a minister who has OCD and who is open to saying clergy can in fact have OCD. But I'm super informal, so please call me Katie, and I'm excited to chat with folks after. I'm here from Atlanta to talk a little bit about my experience with OCD, and I'm just so honored to be here with all of you and with these other amazing speakers. I've really navigated OCD in my own life since before I can remember. So my earliest memories at the age of 8 were around trying to keep the entire world safe. One of the earliest intrusive thoughts I can remember came when my teacher told us all that the sun was going to get too close to the earth at some point and something horrible would happen. And as we know, we get these intrusive thoughts, these obsessions, these what ifs, and we try to use these compulsions to alleviate that, to try to keep everything safe in ways that might not really be helpful, but actually just feed that disorder. So for me, that started as touching everything in a particular order, doing everything correctly, because I thought that if I didn't, the sun would get too close to the earth, everyone would die, and it would be my fault. And that was at age 8. I started to have all of these worries very similar to that in different ways, and I would come home at night, call my parents into my room, and confess my worries, my what ifs, over and over again. And as many of you know, OCD latches on to the things that are the most important to us. Now that I work in the area of OCD, I hear from folks often, well, why does my OCD have to be latched onto this? I could deal with anything except this thing, right? But yeah. And really, for me, that's always been the experience, and I want you to know if that's what you're going through, that's what OCD does. It takes the thing that's the most important to you and kind of twists it. So for me, throughout my entire life, I was always really good at keeping OCD hidden, while internally being plagued with these doubts, these what-if questions about everything meaningful to me. In the OCD world, we often talk about core fears, and for me, this has always come back to, what if I'm a bad person? What if I'm a horrible person? What if I'm a dangerous person? From my earliest memories. So throughout elementary school, middle school, high school, I masked really, really well in ways that folks had no idea that I was struggling, but in ways that were not helpful for me personally. I got very, very good at ruminating and hiding particular rituals and used a lot of really unhealthy coping strategies as I got older, from unhealthy relationships to self-harm to substances, to not let folks know what it was that I was going through. By the time I got to college, I looked again like I had it all together. I was a Division I athlete. I was the top of my religious studies and human services programs, and I was crumbling. I was, at that point, probably doing compulsions 8 to 10 hours a day, and nobody had any idea. And it was something that I just got very good at keeping a secret. So I hit grad school. I went to grad school at Emory to become a minister. And by that point, things kind of had taken on a life of their own. Spending so many years of my life just masking and continuing to engage in compulsions, it started to really take over. So I got to the point where I was no longer sleeping because I was checking oven, stove, lock, and then saying a prayer. Oven, stove, lock, saying a prayer, hundreds of times over the course of the night. Then I would drive back to churches where I was interning to make sure all of the candles were blown out, to make sure everything was locked in the middle of downtown Atlanta, just to make sure nothing bad would happen and that everything was safe. It was around this time that I started to realize that I actually might have OCD. I was doing some dual degrees with the School of Public Health, taking some psychology courses, and finally got up the courage to tell someone what I had been going through. So I shared with one of my mentors in ministry, I think I need to seek treatment before I continue to pursue ordination. And they said, oh, you can't do that. You can't tell anybody about this. If somebody finds out that you're struggling with your mental health, you won't pass your psych evaluations, you won't be ordained, you're up and coming in the field. You just need to shut this down and you need to make it work. So I think everybody here knows how that goes, and that that's not helpful. It's really, really harmful. So I did the best that I could. I actually studied ways to get around things on my psych evaluation so that nobody knew I had OCD. And I was ordained. I moved into my first big role in school chaplaincy at age 25, and there was so much pressure. So I started at the biggest private school in the continental US with 2,700 amazing students from different faith backgrounds. And I was the first female in the role, and my predecessor had been there as many years as I had been alive. So it felt like this amazing opportunity. And also we know that OCD latches on to amazing opportunities and to things that are the most important to us. So very quickly, someone with untreated OCD who had masked for my entire life, OCD started latching on to absolutely everything in that role. Started latching on to my students. I started to question actions of the future, actions of the past. When I was reading to that particular student, did I say something inappropriate? Did I do something inappropriate? Did I kick that kid on crutches? Did I hit someone with my car on the way into campus? All of the things. And I actually sought treatment very much in secret for the first time and started to get better thanks to exposure and response prevention. But the mistake that I made was thinking, I am never gonna have to worry about OCD ever again. It's gone. I don't have to use my skills and tools anymore. I can just dive back into my role. It's gonna be fantastic. And that's not how it works. So unfortunately, I dove back in and had some really difficult periods in my chaplaincy role. I was responsible for leading grief, trauma, and loss responses for this very large community, and unfortunately had some back-to-back really, really intense tragedies, including the suicide of a kid that I cared very much about. And my OCD started to latch on to every tragedy that occurred, and from a harm perspective, a false memory perspective, I started to be convinced that I was committing crimes in Atlanta overnight, blocking them out, and forgetting. I got to a point where every funeral that I was officiating for this community, I was up there trying to figure out how I had somehow caused that loss. So I was a chaplain who looked so happy with these kids during the day, masking, while doing compulsions all day long, and then I would come home and sit and stare at my phone and try not to call 911 on myself for crimes that I hadn't committed. I hated myself. I hated my life. I didn't want to live, and nobody knew. Nobody had any idea. And I was very fortunate, very privileged to be able to get back into treatment. Again, in secret, I was doing intensive treatment at night with a really amazing clinician who was able to work around my schedule to make sure that I could continue to do my job, which in looking back, I have no idea how I did. But I think in some ways also continued to push me to step forward in life. But I got better. ERP and treatment very much started to save my life, and I started to see these little glimmers of hope that I hadn't seen before. And it didn't mean everything was perfect, but I started to see that there really was a possibility for me to live a beautiful life, to actually show up and to be present in the things that were going on around me. And that maybe I was even willing to risk all of the scary stuff being true for a chance at a beautiful life, just maybe. So as I started to get better, I looked around at the students that I was working with, and was working with many kiddos from different faith traditions, again, who were Christian and Jewish and Muslim and Buddhist and Sikh and atheist and agnostic and every possible faith tradition you can imagine. And I was hearing from kids, well, I can't talk about my mental health because I feel shame about that in my particular faith community. And unfortunately, the student that I shared that I lost had very much that same experience. And I felt that I had an obligation as their chaplain, as the faith leader of that community, to start to share that I actually had been seeking mental health treatment in secret and nobody knew about it. I was absolutely terrified to start sharing this because of what my mentor said, because of being in a public role. I thought I would lose my job. I thought that nobody would respect me in ministry anymore. And it was the opposite of everything that I experienced. It was kind of neat. The first time I came out with my story, it was actually a group of my students who were doing a mental health kind of piece in the school magazine. And I said, y'all can be the first ones to tell people that this is what the chaplain has navigated. And I started getting phone calls from families, not to say that they were upset with me, but actually to say, oh, thank goodness, Chaplain Kay, we can actually tell you what's going on in our family. How can we talk to our priest, our rabbi, our imam, our faith leader? How can we have these really important conversations around faith and mental health? It was not at all what I expected. And that was in 2020, so not all that long ago. Pretty shortly after that, I started learning about religious scrupulosity, which I know some folks here know is really where OCD latches onto your particular faith tradition. We know that OCD latches on to whatever is important to you, so of course, all of the what-ifs are gonna come up around faith. And I started to learn about that. I started to hear from clinicians in different spaces that really needed help discerning, well, what's faith and what's OCD? How can we really understand these different faith practices? I had been teaching comparative religions to kids from all different faith backgrounds for the last 7 years, and it felt like a really great opportunity for me to start to share that alongside kind of OCD work and advocacy. So started serving as a lead advocate for the International OCD Foundation, leading their faith and mental health programming, where now we're getting ready to have, I think, our 4th annual Faith and OCD conference, which is super cool, and really building that out, and ended up having the opportunity to shift into that work full time. So I'm now 3 to 4 years really later from where I was just sharing about hitting rock bottom, at a place where I now run an organization that helps clinicians, helps families, individuals with OCD, and faith leaders bridge the gap with religious scrupulosity. I get to train and work on cases all over the world. I also do a podcast, What's the Scoop on Scroop, and all sorts of kind of fun things. But I'm finishing my doctoral research right now on reimagining exposure and response prevention as a spiritual practice across faith traditions. Helping individuals see treatment for OCD in new ways within their communities. So many different things. And I love the work that I do. I feel every time I talk about OCD, which is pretty much every day, this is what I do all the time now, but even here, I get so emotional because I feel so blessed to be in a space just a few years after I was so afraid to share it with anybody, to be in a space where I get to work with amazing humans, to be with amazing humans like you, from different faith backgrounds, from different communities, sharing about OCD. And probably my favorite thing that I get to do now is I lead support groups on Wednesdays with folks from all different faith backgrounds, and I get to see individuals from different parts of the world use spiritual practices through a lens of uncertainty. It's pretty neat to see folks from 5 different faith traditions pray for one another on the journey with OCD, that they can sit with that discomfort, and that's pretty cool. The folks I work with inspire me. Everybody here for showing up, for just being here, y'all inspire me. And I will be honest, you hold me accountable on my journey with OCD, because it is not perfect every day. It is an imperfect journey. And the core fear of what if I'm a bad person is still very much present. And it's something that I have to continue to work on. I often love telling folks, and I really strive for this every day, that every single trigger we have is an opportunity to make OCD smaller. So even coming here to this event, I tried to think of it from the space of, yeah, I'm gonna get up there and I'm gonna feel like an imposter and I'm gonna feel like everybody hates me, and yes, what an awesome opportunity to do it anyway, right? What an awesome opportunity to make OCD even smaller today. But I think the really neat thing is that even though some of those things are still present, I know I don't have to give OCD permission to step back into the driver's seat of my life ever again. And that's thanks to treatment, that's thanks to community, that's thanks to all of you. It's an amazing thing. So now I talk a lot about running towards my values and sticking with the ick. These are like my 2 favorite things. So I would say we stick with the ick, we stick with all of the really hard stuff that's in front of us as we lean into uncertainty, as we keep running toward, moving toward the things that are the most important to us. And that's kind of my daily approach. So I know they shared a little bit earlier about the fact that I'm racing 50 ultramarathons in 50 states to raise money for OCD. And for me, that's a big component of running towards my values. And to be honest, yes, it's something that I'm doing for the community. It's also very much for me. Every single race is a reminder, and training every day is a reminder that no matter how I'm feeling, no matter where OCD is, no matter how close it is in my life, that I can put one foot in front of the other and run towards everything I care about. And I think everybody here can find that in their own life. For me, it's running. I know some people can paint toward their values. You might draw towards your values, read towards your values. And I love the concept of finding that thing that we can continue to do to help us put one foot in front of the other. So I wanted today to just spend a minute or 2 at the end here sharing why I stick with the ick and run toward my values. And I hope this is something that's meaningful to you on your journey. So 1, I do it to advocate and to let you know that you are so much more than your OCD. 2, to help others lean into discomfort, sit with uncertainty, and stick with the ick so they can live the big, beautiful, awesome lives they were created to live. 3, as a reminder that we can all run, walk, paint, dance toward our values, regardless of what OCD says. 4, to remind you that the only thing certain is that by continuing to engage in compulsions, we'll give up life to OCD, and that we are deserving of so much more than that. 5, it's through embracing uncertainty that we find beauty. 6, I run toward my values as a reminder that it's not about accepting the scary stuff as true, but accepting all of life's uncertainties while having faith in the greater good. 7, I run toward my values to remind folks that faith is not about certainty. It's about having radical faith in ourselves, our treatment, and the people that we were created to be as we reclaim our lives. 8, I run toward my values for you, for this community, for my younger self, and for the person maybe who isn't even diagnosed yet, who hasn't been able to find that evidence-based treatment. 9, I run toward my values to remind you that you deserve, and I always like to say, I think when I say you, sometimes I'll admit, when I'm in a talk and I hear someone say you, I'm like, oh, everyone except me, right? No, like, I'm literally talking to you. That you are so deserving to live a big, beautiful, present life. And 10, I run toward my values for a lot of other reasons that I'm probably not even certain of yet. I don't know exactly what the future will hold. And I now, for the first time in a very long time, see that uncertainty can be a really beautiful thing. So as I close, I just want to share something that I talk with care teams and scrupulosity clients about a lot. And that's the fact that it's okay to grieve time lost to OCD. That's okay. It's okay to be frustrated. It's okay to feel the feels. It's okay to be like, this disorder. And from a faith perspective, I always say that we don't necessarily have to have the answers to the why, and yet we can continue to find beauty in the brokenness. To turn our mess into message, to turn our pain into purpose. And for me, the pieces of my life will never go back together exactly the way that they were before. But today, I'm really happy to say that a lot of those pieces that if you would have asked me in 2019 where they were shattered on the floor, have been welded back together into a beautiful mosaic in ways that aren't like before, but are even more beautiful than I could have ever possibly imagined. I grieve all that OCD took from me, and I'm also profoundly grateful to be right here in this moment on this journey. So let's stick with the ick. Let's run toward our values together today and every single day. And I want you to know that you're not alone, wherever you are. We are doing this together. And I am so incredibly honored to be on the journey with each of you. Thank you.
Hi everyone, thank you for joining us. Thank you to our wonderful speakers. I'm Dr. Stephanie Leto. I am a clinical psychologist with the OCD program. And in a surprise turn of events, we are going to have a fourth speaker. So, Dr. Sarah Hoggan is going to come on up. She is wonderful. She's an emergency veterinarian who's going to talk about some wonderful topic that we have not decided yet. And she hopefully is figuring it out. While she's walking up, I want to remind everyone to stop the bleed. Training is going to happen right after Sarah is done. And we still have spots. So please feel free to sign on up and take it away.
Thank you. Like she said, I'm Dr. Sarah Hoggan. I'm an emergency veterinarian. I've only done emergency for 20 years. So good news doesn't ever come to see me. So we have a couple of options about what I can talk with you about. One, if you will do a show of hands, so you guys is objective, you can vote. If you would like to learn how to do pet CPR, I can tell you that. It is very, very similar to human CPR because we are both mammals, so there isn't a large difference there. 2, I can tell you how to do a quick physical exam on your pets, so you're empowered with knowledge, if that is what you would like. Or 3, I can basically tell you a story of what it is like to be an emergency veterinarian that takes care of a police dog and watched how that grief was processed by an entire police department. So it is your choice. So if you would like to hear number 1, how to do CPR, raise your hand please. Okay, so that one didn't win, but anyone who's interested, come to the booth afterwards and I can tell you. Number 2, who would be interested in learning how to do a physical exam on your pet? Okay, that has a lot more. Okay, so that's probably what we're gonna pick. And is anyone interested? Well, the police dog story, if you're interested, come to the booth. I'm happy to tell you. It's not a secret, it's just different. It's something that you don't see. And it puts a very human face on police officers and the relationship that they have with their dogs because they are their dog's first responder. So, how we do a physical exam, the purpose of the physical exam is you want to find out what is going on with your pet. Your biggest challenge is differentiating what is normal versus abnormal. There are two parts to this, and you're fully capable of doing the majority of this. The two parts that I want you to differentiate or learn about is what is called what is subjective and what is objective. Something that is subjective is something that you are interpreting. So, is your pet acting sleepier than normal? That is subjective. That is your opinion. And there's not right versus wrong. Sometimes I can't tell you how many times I'm getting history from a family and the husband says one thing and the wife's like, no, and argues. So don't worry if not everyone agrees with you. Something that is objective is something that is tangible, something that is measured. What is your pet's weight? What is your pet's body temperature? What is your pet's heart rate? That's not open to, opinion. That's a fact. That's a measurement. Those are important parameters to look at. So if you think your pet might be losing weight, put them on a scale. Keep a weight track. That's a simple way to see that's a sign of chronic disease. What is their heart rate? I made a sheet back at the table that has the normal vital signs, which is the pulse, the respiratory rate, the heart rate, which again is pulse. You can either feel it or you can see it. Measure back there, but anyway, sorry. So, those are objective. You can take a photograph of it and keep it. So, first thing you do when you look at your pet, do they look like themselves? Are they looking thinner? Are they looking weaker? Are they sleeping more? Are they eating less? Are they less energetic? What is their affect? Are they bright, shiny, bouncy, making new friends everywhere they go? Are they depressed? Depressed is a relative term in animals. It means that they're not bright, shiny, and bouncy. They're not the dog that greets you at the door. They might be isolated. They might be laying around more. Or they might be hiding, going places off where they don't normally go. The other things that you're going to look at is what is their breathing like. Breathing should be effortless. Breathing shouldn't be working. If you notice that their breathing involves working, if they're using their abdomen as a billows to move air, that's a sign of a problem. When we look at them at where I work, one of the first things we look at is their gums. The reason we look at their gums, we're not trying to see what their teeth look like necessarily. I'm an emergency doctor. I'm not going to tell you your pet's fat or has bad teeth. I'm not super worried about those things. I'm worried about what's going to change the trajectory of your pet's life in the next few hours. So what we worry about, what we look at is the color of the gums and the texture of the gums. Gums should be soft and wet. Just like if you run your own finger across your gums now, they're smooth, they're slippery. That means you're normally hydrated. If they feel dry, if they feel tacky, like drying glue, that's a sign of dehydration. What color is their gums? They should be bazooka bubblegum pink. That's a good color. If they look like grape bazooka, that's not a good color. Red, white, blue are not good colors for gums. Red can be a sign of infection. It's a sign of shock sometimes. White means that their heart isn't beating well enough to put the blood around. Or it can mean they're anemic, that they're bleeding somewhere. Blue or purple is a lack of oxygen. They're having trouble breathing. That's an oh my goodness. If you see those things, don't wait to see how bad they get. That's when you want to get into an emergency hospital immediately, or the closest veterinarian immediately. When you look at how they stand, what is the carriage of their body? Do they stand up straight like normal? Are they holding their head down low? Are they using their eyes to look around? If they have to see something behind them, do they turn like this, like their neck hurts? Because a dog should be able to turn like this. So there's more things that families see, they just don't know what they're seeing. So watch your pet. If you're not sure if he if his head hurts or something like that, you can certainly go behind him and make a noise. You're not trying to terrify him, don't use a starter's pistol, but make a novel sound. Something weird that they're not used to hearing. They should turn around and see what happened behind them. If they don't turn their head and they turn their whole body, their neck probably hurts. You can, when you're petting them, push down on their neck a little bit, push down on their backbone. Do they react to that? Do they respond like lightning just went through them? That's a sign of discomfort. That's a sign of pain. Pets do what's called guarding. If their foot hurts and you reach for it, they're gonna keep it away from you. It hurts, don't poke that. If you pet their abdomen or touch their abdomen on both sides, it should feel soft. You should be able to put a little pressure easily. If you touch their abdomen and it feels like a tight, flexed muscle, that's a sign of discomfort. Their abdomen hurts. Or if you try to touch it, and again, they're guarding, they're keeping away from you. That's a sign of pain. When they're walking, are they putting even normal pressure in their gait? Are they dragging a limb or carrying a limb? If they drag a limb, that most commonly means there's a nerve problem because they can't use it. If they're carrying a limb, that means they can feel it and they're saying this hurts. I don't want to put weight on it. If you have an older dog that's typically a big dog, and when they're running, do they run with both legs going in like that, like how we run? Or are they bunny hopping? If they're bunny hopping, using back legs together, that means their hip mechanism is wearing out because your hip's supposed to slide back and forth. If it doesn't work that way, then you compensate because you're a dog, because you can't go to your mom and go, yeah, this hurts. So instead, you just say, well, I'm just gonna hop because then I can use both legs together and I can compensate. Are they holding their tail up and alert? Or are they tucking their tail? Either one of those can be normal. The tail's kind of an antenna of attitude for dogs. If a tail's tucked, that's sorrow or shame. Or if it's just, limping down, it means I don't feel good. If the tail's up, the head's alert. And if you see the hackles going up down the back, that's, I'm on high alert. That's when a dog is saying there's something wrong, or I'm thoroughly displeased and I'm getting ready to put a smackdown on something. So be aware of that. If they're holding their tail straight out from their body and they're acting like uncomfortable when they're walking, that can be spinal pain, lower spinal pain, or tail pain. We see a thing called swimmer's tail in a lot of dogs, like Labrador retrievers that have been swimming all day. They're using their tail as a rudder. They're moving it probably 1,000 times against the strength of water, so they strain those muscles horribly. And when those dogs walk in, families say he won't sit down and he's just screaming, and he screams every time he moves his tail. Yeah, he overworked those muscles and they're swelling, they hurt. Another quick thing to evaluate is what are called cranial nerves. There are 12 cranial nerves in mammals. Those are nerves that come straight off the brain and go straight into the face. They can be a little bit harder to check all of them in dogs, but there are some big ones that you can notice pretty quickly. Some are a little easier to see in cats. First cranial nerve is smell. Are they using their nose appropriately? If you're not sure if they're using their nose appropriately, give them something novel to sniff. Something that doesn't have a strong fragrance. If you're like, here's fried chicken or pepperoni pizza, that's really strong. They're probably gonna be able to smell that even if it's compromised. Offer them a piece of celery. What is that smell? That's not food. It is food, but you just don't like it. Second cranial nerve has to do with the ability to see. In dogs, we do what's called a menace check. And it's a reflex. So if you see something that's gonna poke you in the eye, you wince. That's a reflex. Dogs do the same thing. Some people do it with their whole hand. Careful with the whole hand is you're waving a bunch of air at the eye. Okay, if someone's blowing in your eye, you're gonna blink. But we wanna see the menace response. This is only in dogs that are older than a year. So don't do it in a puppy and go, oh my God, he's blind. No, he's not. He's just not developed all the way yet. It's like an 18-year-old. The brain isn't all the way there yet, so wait till they're 25. But at age 1 in dogs, they'll have a menace response. The third cranial nerve is pupillary light reflex. How big is the pupil, and do the pupils match? If you've got a tiny pupil and a big pupil, that's not normal. That's concerning. Now, it may not always be concerning. They maybe have had some sort of minor head trauma as a puppy. That could be still old scar tissue, but it's not normal, so it's worth getting checked out. Fourth cranial nerve has to do with eye position. Difficult to evaluate in dogs, pretty easy in cats. Vertical pupil in cats. You can tell if it's straight up or down or off to the side. That's pretty easy. With a dog, you have to dilate their eye, look at the back of the retina with a round lens. A lot harder. Fifth cranial nerve is called the trigeminal nerve. It has a lot of different branches, but the easiest one to tell is sensory. Can they feel their nose? And so what we do is we take a pen, of course I don't have a pen, but we literally poke their nose. And we poke the inside, deviate the navel septum. That's the thing that separates your nostrils. Noses are sensitive, and noses are very private in dogs. Bums are public, paws and noses are private. Opposite people. So, if you go to touch their nose, they should tell you that's a no thank you. And they'll normally tell you that's a no thank you and back away or turn their head away. Or if it's a really easygoing dog, like a golden retriever, they're like, sure, pick my nose, I don't know. They should at least lick, because it's sensory, it's sensitive. If they let you sit there and poke and they don't respond, that means they probably can't feel it. So that's a concern. Sixth cranial nerve, again, is harder to tell. We look with the eyes. Seventh is the facial nerve. Can you feel your face? We tap the side of their eye, not their eyeball, but right at the edge of their eyelid. Normal reaction, you blink. If you tap here or here and they don't blink, they probably can't feel it. That's a concern. Eighth cranial nerve has to do with hearing and with balance. And so if your dog wakes up one day and their head is cocked to the side, that's a sign of vestibular a lot of times. Vestibular is called vertigo in humans. It means your balance is off. So if they have a middle ear infection, that can cause that. There's also what's called idiopathic vestibular disease. If you ever see the word idiopathic, that is a medical word for I don't know. Literally, not being silly. Idiopathic means that, yeah, there's truly a problem there, but we don't know what caused it. And that's not good or bad, it just is. Epilepsy can be an idiopathic disorder. Yes, you authentically have seizures, but we don't know why you have seizures. So we can see idiopathic vestibular disease in dogs, where their head is cocked to the side. Also, with one of the signs of vestibular can be the motion of their eyes. Are their eyes stationary, or are their eyes dancing back and forth while their head is stationary? That's called nystagmus. Dancing back and forth, dancing up and down, or spinning in their sockets. All of those are abnormal eye movements. And when you see it, you'll recognize it. That was 8th. 9th is auditory. 10th, hard to evaluate. 12th, easy to evaluate. 12th is motor to the tongue in dogs. Tongue should be symmetrical. Tongue should be able to move left or right if they want to, in and out, like a lot of things. If you notice the tongue is consistently pulled to one side. Now, it's different if they lose their canines, because canine job is to hold your tongue in the middle. So if you lose 2 canines in one side, that tongue's gonna fall out. But if you notice one side of the tongue looks kind of shriveled, like, you know how a piece of bacon looks shriveled? So if one side looks like raw bacon and flat, and one side looks a little bit like cooked bacon and wobbly, sorry, that's a bad analogy, but I can't think of how else to explain it. That means that there could be nerve loss to that side. And when that happens, then the stronger side pulls it over. So you'll see their tongue is off center. Other thing to look at on dogs is what are called the muscles of mastication. Mastication is chewing. So think of a dog that has like a big square blocky head, like a textbook pit bull. You know, they got that big square head. That's because the muscles on top of their head that pulls their jaw closed are huge. So if suddenly they don't have a big blocky head, if suddenly they have a ridge on their head that you can feel, a ridge of bone, that means those muscles have atrophied. That means something's wrong. Atrophy and kind of means like shriveled up. So you can imagine if you have muscles that aren't working anymore, that aren't being used at all, then they're a lot smaller than someone who's a weightlifter, who's using their muscles all the time. So if these muscles get really small and you can suddenly feel a bony ridge up there, it means something's wrong. It means that they may have either lost their nerve conduction to them, or there could be something, you know, are they not able to chew anymore? What's happening? Are they losing weight to the point that their body is saying, I can't take in enough calories, so I'm going to start digesting my own muscle mass to feed me? So those are the things that you're going to look for on a physical exam. Other common, easy things to look at. What does their poop look like? Everyone kind of knows what dog poop should look like. If it looks like it's bloody, or if it looks like it's, this is going to sound gross and I apologize, but if it looks mucoid, mucousy, that means the colon's irritated. That's their body telling you something's wrong. Look at their urine. Does it look highlighter yellow? Does it look dark like coffee? That means that they're dumping pigment into their urine that doesn't belong. Does it look super duper clear, like they haven't, you know, like someone just poured water on the floor? That could mean that they're drinking inappropriate amounts and their kidneys either aren't working or they have something else like diabetes going on. So the urine's too clear to ever get concentrated. So the things that you want to look for to evaluate your pet's health, you probably see every day, and you just don't know what you're seeing. So, are they bright and shiny and bouncy? Are they quiet and withdrawn? Are they eating and drinking their normal amounts? Or are they drinking 10 times more than they ever had before? Or are they not eating very much, and you're having to beg them to take food in? Are they sleeping all the time? Or are they getting up at night and pacing incessantly? Kind of like their brain isn't working and they're wandering and they're not sure what's happening. Look at their face. What are their eyes doing? Does their nose work? Does the shape of their head look like the same it always has? Do they look skinnier or fatter than they used to? Or does one part of them look abnormal? Does one foot look really swollen? Does their abdomen look distended? When they're breathing, is it effortless? Or is their abdomen billows? Working to breathe, moving that air. Look at the color of their gums. Red, white, and blue are only good on flags, never good on dogs. So does that all make sense? Is that way more medicine than you ever wanted? Okay, so I don't know how much more time I have.
We should probably end, because we have to do
Affirmative.
the
You could have stopped me at any time. I'm
No,
sorry,
you were
I wasn't
good.
sure.
Thank you to all our speakers. Let's give them another round of applause. So we have a stop bleed training happening right over there. So they